Elizabeth Scala here from elizabethscala.com. Thank you for viewing these educational, content-filled, and hopefully helpful resource videos. This next video is going to speak to, I have an autoresponder or sort of a quick question that I put out to folks once they subscribe to my email newsletter. They receive a quick question that says, you know, what's your biggest challenge with respect to your nursing career? Which I can get responses all over the gamut, but let me tell you the most common response, which I'm sure many of you have said once or twice in your past, is time. I don't have enough time, right? Especially being a nurse. I feel like I'm constantly at work. This one person who responded back in December of 2015 said, there seems to never be enough to accomplish what's already on my task list, and yet additional requirements, regulations, projects, initiatives all get added daily. I feel like I'm constantly treading water and can't appreciate what I love about being a nurse and clinical educator. So first off, this speaks to an important concept related to feeling like we're always involved in the technology of nursing. This is what I heard in 2013, 2014, constantly, what led me to create the Art of Nursing program, which this video is not about, but you can find out more about the Art of Nursing program at elizabethscala.com and go to the top where it says events and it has a Nurses Week tab. That being said, you are all right. Technology is something that as a nurse we are using constantly, and it's not going away. In fact, maybe we'll get more technology as healthcare continues to evolve. And technology is certainly a good thing. It helps us save lives, it helps us save time, even though this is counterintuitive, but essentially technology is there to save time. It certainly does make things easier. You know, we are able to collect data. We're able to actually read the orders that the providers are handing to us. We're able to track outcomes in a measurable and meaningful way. So technology is good. The challenge is that we don't have time then, or we feel we don't have time to spend with our patients. So I certainly understand where this nurse is coming from. There's so many projects, so many tasks, and we're constantly treading water. How can we keep up? Well, let me just share one simple method which I like to talk about a lot, so you may have heard it before, but it speaks to the breath. In fact, my dog is passed out on the floor here and snoring very loudly, so if you hear that in the background of this video, he is breathing. My point is, before you go into any client or patient interaction, before you pick up your ASCOM phone, before you go to wash your hands, or even as you're washing your hands, can you just come present, feel the feet on the floor, feel the physical body, kind of feel your scrubs against your skin, and breathe in and out of your nose. When there's a thought, letting it go for that moment, it will come back, but just focusing on the breath. This is the very core. This is the one thing that you have control of, and this is the easiest thing to do. It's free, it's simple, it's with you all the time. So this is the first step I would suggest to feeling as though you have more time for your work. Now, if you already know about this and you're like, yeah, Elizabeth, got that, come on over to elizabethscala.com and check out the Art of Nursing program for Nurses Week, or check out some of the other videos on this page that deal with the Art of Nursing, because I give you a couple of other tips in terms of how to feel more present and as though you have time for it all in your busy nursing career.